When a child is newly diagnosed with autism, there are a ton of questions. Today, I'm talking with Kelsey, who's asking the top 5 questions we get about this really critical time when a child is newly diagnosed with autism. Let's get to it. All right. Well, thank you, Kelsey, for joining us and for gathering our top 5 questions we get about a child being new to the autism world, being newly diagnosed. So, what's our first question?
Well, our first question is probably the question you all have when you're leaving with a new diagnosis is my child was just diagnosed. What should I do now?
Yeah. So, I mean, it's been a long time, 25 years since my son Lucas was diagnosed. And I remember the day vividly. So, it is a very, even if you're expecting the diagnosis, which we were, it still is a very hard day for a lot of reasons. We were expecting, a more mild diagnosis, more, um, it's going to be fine, but we didn't really get that. We got, no, it's moderate to severe autism and it's going to be a long haul. And um, our developmental pediatrician at a children's hospital of Philadelphia, who diagnosed Lucas, did tell us that we needed applied behavior analysis treatment. Um, and a lot of people, I was just interviewed recently, Carrie Carriola. She said in 2006 her son was diagnosed, and she never heard a recommendation for applied behavior analysis. So one of the things I would do is just use the day or the week to sit with the diagnosis, to not panic, to just to try to breathe, to try to be as calm as possible. If you meditate or journal, or if if you can talk to your spouse or your mom or your sister or your best friend about your feelings, because they are real, whatever those feelings are. Um, and then I do think that if I were you, I would look into exactly what you should do. And it's going to be different depending on where you live, if you work, if you have other children, if you have financial resources, if you have insurance or can figure out how to navigate systems, if you already have early intervention services in place or have other things in place. And some kids get diagnosed later, like even in high school or later than that. We're really talking about new diagnosis of young children. Um, Kids can get diagnosed as early as 15 months, 18 months, definitely by 2. If somebody's saying, "Oh, we have to wait until they're 3," they're probably, not who I'd be listening to. Um, so I would say, try to stay as calm as possible. Your child is the same child that he was the day before. This diagnosis is really, it's by observation, it's by symptomatology. It can change. It can, your child can get better in terms of skills. So um try to stay calm, and then in a day or 2 or week or 2, start taking action.
Yeah, I would agree with everything you said, especially that your child was the same, before the diagnosis. Nothing about your child changes because they have this diagnosis, and no one has a crystal ball to say that their future is positive or negative or whatever because of an autism diagnosis. It's just what it is today. It's what it is as a snapshot in time. And the best thing you can do to get started is to um, keep yourself calm, like Mary said, and as you start to move forward, maybe joining local autism group or a local autism society to learn about what's going on in your area, because every area, state, and country offers different things. Um, and the more you can gain knowledge yourself, whether it's on therapies, whether it's on how the systems work in your area. Those are going to be the most important pieces for long term. Um, if you don't understand the systems of how to get supports in your region, that can be a big barrier. So even before jumping into looking at what to do, giving yourself what to do for your child, giving yourself the knowledge is going to really help you feel a lot more confident on this journey.
Yeah, and also the Turn Autism Around book, it's the book I needed the day, or actually my husband first mentioned the possibility. It's the book I needed when he was diagnosed, or when a couple months before, when we knew the diagnosis was probably coming. So you can start reading Turn Autism Around for free at turnautismaround.com and get all the book resources. So start with that. I have a free webinar that's really good that can help you, not day one, but even a month, 2 months, 7 months, a year before a diagnosis. Half of our toddler course members who introduce themselves do not have an autism diagnosis. So really the intervention is the same as it was 3 months ago. So the more knowledge you can accrue, whether you're waiting for a diagnosis or just have a diagnosis of speech delay, um, the more knowledgeable you are in terms of preventing problem behaviors and teaching language and learning how to advocate for your child, learning the system, that's all going to be, really important. But don't panic, don't feel guilty, don't beat yourself up. You, the information you have, you do the best you can with the information you have. When you get new information, you can make changes. So no need to panic. There's a lot of support out there.
Yeah, and that brings us to our next question, which is, will they improve or is this lifelong?
Yeah, so most people say that autism is a lifelong disorder, that once you have a diagnosis, that's it. And but research starting way back in the 1980s, including a research study that was just published in October of 2023. I just did a solo show on this. That is going to come out, but this study is October 2023, and it's called The Persistence of Autism Spectrum Disorder from Early Childhood Through School Age. I'm not going to, you know, uh, give you all the bullet points from this study, but basically they took 213 kids who were diagnosed with a valid diagnosis of autism up in Boston. And then they relooked at those kids when between the ages of 5 and 7. They were diagnosed between 1 and 3. Most of the kids were 2. And out of those kids that were diagnosed between 1 and 3, and they relooked at them from 5 to 7, 37.1% of them had what they are titling non-persistent ASD, meaning they did improve to the point where they no longer met the diagnostic criteria for autism. So this is an exciting study. I mean, there's of course variables. The girls in the study did better than the boys, and also adaptive skills on baseline were an important variable for kids that did get really all better, mostly better. We have an example. I interviewed Michelle C for like the 5th time, I think. That's going to air like a week or 2 before this episode airs. And Elena, her daughter, who's featured in the Turn Autism Around book and in the white paper, which we can link in the show notes, marybarbera.com/white paper, is a story of Michelle's daughter, Elena, who was diagnosed right before COVID. The world shut down. She had no services, including no Zoom services, nothing. She was stuck at home with a newborn and Elena. And through my online course and community, she managed to make major progress. Um, Kelsey has a son, Lincoln, who's made major progress, and he no longer, probably, if he were tested today, no longer might not get a diagnosis of autism. But once you get a diagnosis of autism, um, this study also didn't show if these kids still have a speech and language problem, if these kids still have signs of ADHD or anything like that, OCD. So kids will improve. That Kelsey has Brentley, who has improved greatly, but he still has moderate to severe autism. I have Lucas, who's 27, who's made major progress over the years. He still remains impaired with moderate to severe autism and an intellectual disability, and he needs 24/7 care. So yes, I think all kids will improve, especially with treatment, especially with at least one parent taking the lead, and becoming the captain of the ship. Will this be a lifelong disorder with no ability to change the diagnosis, or undiagnosed kids, which is happens? I mean, nobody knows really what percentage it happens, but it's not 0. Um, and so instead of looking at it like this is a lifelong thing, look at it like, let me find their strengths and needs in terms of self-care, in terms of language, and in terms of problem behavior. Let me make a plan. Let me coordinate its services to help them reach their fullest potential. That's all the Turn Autism Around approach does, is like we're just trying to help kids increase talking, decrease tantrums, improve picky eating, sleeping, potty training. We just want improvement. And so you can't really set a goal that, this child's going to have non-persistent ASD, whatever that looks like. But you can set a goal that you want to improve language, and you want to teach potty training, and you want to reduce problem behaviors, and all those are certainly within reach.
Yeah, I'd agree. And I think the worst thing you can do is turn something into a catastrophe. You don't know. I mean, even if you have a typical kid, you don't know what the future is going to look like. There's plenty of typically developing kids who struggle to leave home, who struggle with different things, and there's plenty of children with disabilities who are in wonderful programs that where they're supported. You talked about it with Carrie Cariello, of how there's lots of different options. So life is never one way or another. Kids can improve, um, and be, Lincoln is fully conversational. Most people would not see that he has an autism diagnosis. He probably wouldn't meet the criteria. He does still struggle with anxiety and emotional regulation, and there's lots of kids who don't have an autism diagnosis who struggle with that. So the best thing you can do is focus on right now, and improving, what their needs are, and promoting their needs with their strengths. So that brings us to our next question is, okay, so what is the best way to help them? I've heard they need 40 hours of ABA. Is this true?
I used to think, and Lucas got 40 hours of ABA therapy, paid for by medical assistants in Pennsylvania back in the late 1990s and early 2000s. And I used to, as a behavior analyst, used to recommend people, get as many services as possible, get early intervention in, stand in line for ABA, take it. It doesn't have to be perfect. But now I'm like, you know what? Let's breathe. Let's take our time with it. Let's find their strengths and needs by doing my digital assessment, making a plan, seeing what's working for your child, for your family, seeing what's working now, and then planning and interviewing speech therapists, interviewing ABA companies, seeing if that works with your family. Maybe your child still takes a nap. Maybe just in the mornings would be good in your home. Maybe it works out better if they go to daycare and they, depending on the child's functioning level. Um, so the real key is that all kids, especially kids with a diagnosis of autism, need not just 20 hours a week, not just 30 hours a week, not just 40 hours a week. They need to be engaged in positive activities with an adult or an older child or a caregiver for most of their waking hours. And when I've calculated that number is about 100 hours a week. So even if your child is in a full-time ABA program or a full-time preschool or daycare situation, there's still so much you can do to learn how to tackle potty training, going to the doctors, uh, all those things, going to the grocery store, having play dates, how to get the right services. But you definitely shouldn't be getting services that are leading to tantrums, crying, listening to advice to let kids cry it out, which I don't believe in. Um, there's just a whole lot of very well-meaning professionals who are not giving the right advice. Um, and I know with my book and my courses and our community that we are giving evidence-based advice to keep things positive, to move things in the right direction, to individualize, to teach parents and professionals how to individualize the approach to help each child get to the next level. Oh, you're muted, Klaus.
Sorry. I would agree with everything you said, in that I think that 40 hours of any therapy or any therapy can be great and it can also make things worse. We had someone in our community ask a question just today about, since I stopped doing, something at home and they've been in ABA full time, their language has regressed. And that's not doesn't mean that they're bad providers necessarily or anything. It just means that the best thing you can do for your child is learn how to support them at home because that also transfers into advocating for them in therapy, and advocating for the people providing therapy to you know be providing therapy based on your family values. um, Remember that your child is still your child. You are still you know how to parent, you know them best, your family values still matter, and we want our kids to be engaged, like Mary said, in most of their waking hours. If you can't provide that, whether it's therapy, whether it's a nanny at home, whether it's learning through Mary's courses and then training the nanny, whether it's,
A
having a one-to-one,
grandmother
yeah,
or
or grandmother or
a mommy's
anyone.
helper or a
Yeah,
volunteer from church. It doesn't, or an older sibling who's bored, you know, um, we just need engagement and not just kids
yeah,
watching TV, doing
yeah,
iPads, or doing excessive self-stimulatory behavior where, you know, is it harmful? Well, if they need to be engaged with talking and listening and understanding, and they're building blocks over and over again, or putting straws in bottle over and over again, or lining things up, it's it's not doing much for their brain growth and development.
yeah, yeah. So that brings us to our next question, which is, how can I tell my friends and family about this diagnosis?
Yeah, I asked this question to Dr. Copeland, who diagnosed Lucas, and we do have a very old episode with Dr. Copeland. We can link in the show notes. But I asked him, like, do I tell people or what do I, and he had some good advice. He's like, you don't have to like scream it from the mountaintops. People that you're close to though, you should tell them. It's not a big secret. You know, it is what it is. It's a diagnosis. And, um, you know, people, if they don't know the diagnosis, they won't be able to support you. I remember I took him to his barber who, Barber John had cut his hair since the first haircut, way before his diagnosis. And, he went to our church. He was a nice guy. And so after I got the diagnosis, I went in and I said, I just want you to know Lucas was diagnosed with autism. And so we're going to, I prepared this little book and we're going to try to like make haircuts go better and everything. And the next time I went to get his haircut, he's like, I'm really glad that you told me about his autism. I've been praying for him twice a day. And I'm like, "Oh, that's so nice." But he continued to cut his hair until he retired, and now his daughter, Michelle, cuts his hair. But, people, there's no shame in it. There's no, people can support you if they know, but and it might be a gradual thing over time. And if you want to get started with therapy and you don't wanna tell people, that's fine too. You don't have to, tell people that you're not super close with.
Yeah, I think telling whoever you're comfortable with and whoever's in your life, is important. There's no shame in it. There's nothing you did. It's not your fault. And Mary and I were talking earlier, and she said, like, if you don't necessarily tell people, they're going to assume their own story. Because
Good.
for a lot of our kids who are diagnosed early, um, they're having excessive tantrums. They're probably not talking as much as, the neighbor child. And people will make their own stories. Oh, Susie lets him watch so much TV. That's why he's not talking. So sometimes it's best to just be open and just say, this is what it is, and we're working to give him the supports he needs. And yeah, we're happy to have you here supporting our family. But do what feels right for you and don't feel shame whatever way that swings you. Which brings us to the next thing. I am grieving and worried about my child's future. What can I do?
Yeah. And, you know, in years past, when the spectrum of autism, when Asperger's was no longer a thing, and so autism is this huge, huge spectrum, and some subset of the group, I'm not sure how many or what percentage, but they believe like autism is a gift, and you shouldn't say anything about it being devastating or alarming. Like I get on social media every day. In fact, we got something, yesterday. Like I was saying, the rate of autism went from 1 in 500 to 1 in 36. Like that's alarming. And then I got some person with autism who said, "Don't say alarming. Why are you acting like it's a tragedy? You shouldn't have to grieve," like that kind of thing that people are hearing. And as a mom, and Kelsey's a mom to two sons with autism, I'm a mom to one son with autism, and I think it's fine to grieve. It's fine to grieve. Even the next couple months or couple years are not going to be typical. Like you are going to have to do things probably a little bit differently than you had envisioned. But it's okay to grieve that. And to, but I see this a lot too, is like a mom of a 4-year-old with, aggression, not talking, not potty trained, and she's worried about when she's dead or when he's a teenager or when he's an adult. And I think that's a mistake. I think we need to focus on them right now and how to support them and how to get the aggression to near zero levels and how to get talking up or some form of communication. We need to get the child happy now. Um, don't think too far in it, in the future. And when your kids are under 18, they should have a guardian in your will. You should have some plan Bs. Don't think about, you know, way too in the future because your child can really, really change. Like you probably can't even imagine what Lincoln and Brentley are going to need, but especially Lincoln because he's fully conversational now, you know, and but even for typically developing kids, you don't know what's going to come in the future. So really on the way home from the diagnosis, I was really grieving back in 1999 and saying my husband saying things like he'll never go to college, he'll never get married, you know, and I was like, stop it. Like I'm crying. This is a, you know, a bad day. And I'm telling him, like, your brother never got married. You know, there's plenty of people that don't go to college. Like, we don't know. Spencer was only 18 months at the time. Like maybe he's going to have a learning disability. Maybe he'll have a head injury. Maybe he'll do drugs. Like you can't like in that car ride on the way home was like the whole all of my expectations, the suburbs with the white picket fence, like went out the window. I'm like, we have no control over what our lives are going to be like, let alone what our kids' health is gonna be like and how they're gonna progress. So I think you just in my first book, the dedication is like to Lucas, who's taught me how to hope, but not to expect, and to appreciate the small steps along the way. And I think when you're feeling grief and sadness, and some people need to go to counseling for that grief and sadness. Some people need to go on depression medication. Some people need to go to counseling, meditate, journal. Like that also is nothing to be ashamed about. Um, but for me, I kind of let my expectations, you know, go. And I think that was good for me personally. Um, and I really encourage people to be more focused on the present and the immediate future and trying to help their kids and their clients, you know, become as safe as possible, as independent as possible, and as happy as possible. And happiness starts now, not like I hope they're happy when they're a teen. No, I want them happy every day. I don't want to hear crying. I don't want them to be upset. I don't want them to be miserable. And so if any kind of therapy is causing that over, you know, any kind of time and the professionals aren't willing to change strategies or change approaches. It might be a medical problem. Like I am very much like, let's overturn the rocks. Let's figure out what's going on so that we can get a child and a family back to equilibrium so that there is less grief. But grief is normal when you get a diagnosis of autism. And I don't think you should feel any shame about that.
Yeah, I would agree with everything you said, Mary, and I think grief is a normal emotion. I didn't struggle with grief after Brentley was diagnosed. I was mostly relieved and kind of in action mode. Um, and
But
I've talked about
you
that.
had waited for a year too.
Waited for a year and Brentley was struggling. And I think sometimes to put a name to something is like, well, at least we have a name for it. You
Mhm.
know, at least it felt very for me like, okay, now we can move forward. And I mean, when I think about how much autism has brought into my life, you know, from you and helping other families, and I think so much empathy and learning, and, you know, I'm not going to say I'm necessarily grateful for autism or grateful for the struggles he has, but I mean, it does give you a new insight on life and on, you know, humanity and all kinds of things. Do I want my child to struggle? No. And I grieve for him sometimes too. Sometimes I feel sad that, you know, he deals with what he deals with and but a typical kid could deal with you know bullying or different things as well and but I think it's important to like Mary said take it one day at a time and take care of yourself as best you can and so that you can help your child and know that it's normal but also remember that you know, there's so much out there now. What if your dream was for your child to play sports, maybe they won't play on a regular soccer team. There's lots of adaptive soccer teams, you know. things are changing and there's opportunities out there for children of all abilities, which is nice to see.
Right. And maybe they will, play on a regular team and be a star, and maybe they'll go to college, and maybe they'll get married, and maybe they'll drive, and maybe they won't. And at some point in time, you probably will know. Um, and I did a paper when I was getting my PhD, and it definitely, the whole autism diagnosis changes your worldview, changes your lens of how you look at things. And yeah, it's just um your hope, like in this paper, it was something about false hope. And actually, in whatever study I was looking at, they said there really isn't false hope. It's like your hope shifts over time. So, like, I used to hope that Lucas would get all better and that he would, drive and go to college and get married. And now, then when he was 6 or 7 or 8, when I was like, I don't think that's going to happen, then your hope is that he become independent, or we get problem behaviors to 0, or he becomes conversational. Now, he's still not conversational at 27, but he is, major problem behaviors are at or near 0. He can do every self-care task and can make his food, and really needs supervision, not in-depth care. And so it really does shift, but it comes down to as safe as possible, as independent as possible, and as happy as possible for both my kids and every child I've ever seen. It just looks different depending on the child, but nobody has a crystal ball to look forward or backwards. So um, my best piece of advice is just to get the diagnosis. When you get the diagnosis, just sit with it and take action. Don't take crazy action where you end up throwing yourself off the boat. Take action, um, see results, and try to keep your family and your child and yourself happy, content, moving forward. And whatever happens in the future is going to happen. And there are some things that you don't have control over. All right. Well, I think that's our last question. Thank you so much for um, sitting down with us today, Kelsey, to ask those questions and to generate them. I think it's a valuable topic. There's a lot people can do when there's a new diagnosis, and hopefully this helps many people. So thank you.
Thank you.